So one of the things that's really striking about being here at COP is how many groups there are. So of course there are governmental groups, there are negotiating groups on behalf of nation states here, etc. There's people like us here, so health bodies, there are civil society groups, there are NGOs here, there are groupings of for example, mountain state groups or rainforest groups, so indigenous people are represented here, youth are represented here, and then all sorts of bodies representing industry, various parts of from housing to energy to shipping. So there's just a vast array of people here with all sorts of different perspectives, all sorts of different agendas, and yet the atmosphere is very civil, and it's very easy to strike up conversations and start having conversations across these these what could be divides, I suppose, in other respects. So one thing that I've picked up over the last few days is around the vast level of systems change that is being spoken about and is going to be needed to solve the problems of climate and ecological change. And I've been thinking a bit about the implications of that for the patients that we see in our service, as well as for population mental health. And I suppose there's been 4 areas that I've been struck by could be really helpful for us in mental health, for either preventing or treating better mental health problems. So those things are, first of all, air pollution. And there's a big drive to improve air quality and come within much better standards across the globe for air pollution. And if that happens, then there's potentially a big preventative gain for mental health, in that there's a number of conditions across the life course that increasing evidence shows are caused by air pollution, from sort of emerging psychotic symptoms through to dementia, through to other mental health problems. So that's one. I think another one would be access to green space. So if green spaces are promoted, increased, particularly in urban areas, and there's a big push for that, because what it will do is reduce, it acts as a carbon sink and is a way of mitigating carbon emissions. So increases to green space would lead to benefits on population mental health, because there's pretty good evidence that access to green space is helpful for mental health, but also there's an inequality angle there, and the potential for people who really have very significant mental health problems may have better access to green space themselves. Thirdly, if we look at active transport, and it's interesting to note that a lot of health experts here do not see the electric vehicle as the solution to urban transport. It's much more around active transport, access to cycling, access to walking, and better public transport. And that leads to health, physical health gains for everyone, and I think that is an important point to make with respect to the sorts of people that we see in our services who often have very poor physical health. And the fourth one is housing. So a big push around energy efficient housing, improving housing, so as a way of reducing greenhouse gas emission, obviously. But what that would mean is that homes would become more comfortable in the winter and better able to withstand heat in the summer. And that made me reflect on the numbers of people we see in our services who have really poor housing and actually are in fuel poverty. And if there were a real push across the population to improve housing conditions, what a positive impact that would have for many of our patients, particularly around their physical health in winter, but possibly their mental health as well. So those are 4 areas that I've been hearing about here at COP, where the co-benefits for mental health of taking climate action are really, I think really could be very significant. So it could be an example of a real win-win situation for once.